Most people believe heart attacks come with warning signals: crushing chest pain, a numb arm, a dramatic collapse. That's the Hollywood version. That's what people expect. Yet after turning 60, the most life-threatening cardiac episodes are frequently the quiet ones, the ones that develop silently while you're sleeping. No symptoms, no time to react, no opportunity for a do-over. And here's what astonishes my patients when I explain this in the recovery room. Those events are triggered almost always by something routine, something unremarkable, something totally ordinary that you did before turning off the lights. I've spent over 2 decades performing cardiac surgery, restoring blocked vessels, and holding hearts in my hands. I've also watched the same preventable scenarios repeat across countless patients who were completely unaware of what they were doing to themselves each night. Today, I'm showing you 5 of those scenarios, 5 evening behaviors that are silently setting the stage while you sleep. Then I'll share exactly how to reverse that, one straightforward evening at a time. Stay with me through this. Everything I'm about to walk you through, the hidden risks that happen while you sleep, this is exactly what my patients ask about constantly. I gathered everything I tell my own patients and created one simple strategy for staying healthier and more independent after 60. It covers 28 significant health shifts that happen with aging, things like blood pressure, glucose levels, brain function, balance, and that's just the beginning. Thousands of people are already using it to take control of their health, and it's helped many of them live their best years after 60. You'll find the link right here in the video description and the pinned comment, so you can grab it whenever you're ready. What you're going to learn today in these few minutes might be among the most significant things you hear this year. Here's what most people don't understand. Your cardiovascular system doesn't shut down when you fall asleep. It shifts into a different mode. During healthy sleep, your blood pressure naturally decreases, usually dropping between 10 to 20% compared to daytime readings. Your heart rate decelerates, your blood vessels loosen. It's your body's biological maintenance cycle, something you've had running since birth. But after 60, that protective system becomes less stable. Vessel walls stiffen. Blood pressure control becomes less precise. Hormonal signals that once guarded your heart at night begin to fade, and room for error shrinks considerably. Picture it this way. During waking hours, your cardiovascular system has multiple safeguards. It adjusts, it responds. While you're asleep, many of those protective systems are essentially offline. Your heart is running with minimal support. That's what makes nighttime fundamentally different after 60. That's why the window between midnight and dawn poses the greatest threat for cardiac events and strokes in older adults. Not the afternoon rush, not morning activity, but those quiet hours when nobody's checking on you, yet your habits are actively working. Here's what changes everything. What unfolds during those vulnerable hours is almost entirely shaped by what you did before bed. Your dinner timing and portions, whether you took your medication, your bedroom's temperature, choices that seem completely unremarkable. That's where we're headed, starting right now with the first behavior that shocks my patients most. Let me ask you this. When did you eat your last meal yesterday? What did your plate contain? I pose this to every patient. Remarkably, many people over 60 tell me they had dinner around 8, 9, or even 10 p.m., a substantial meal with pasta, grains, protein, possibly deep-fried items, followed by relaxing on the sofa and falling asleep within an hour or two. I recognize the pattern. Extended work hours, family obligations, ingrained habits. But cardiology-wise, this pattern is putting real strain on your heart. Consuming a large meal close to bedtime creates significant cardiovascular stress. Here's what occurs physiologically. A big meal forces your digestive system to demand massive blood flow increases. Your heart pumps with more force. Your blood pressure climbs. The fats coursing through your bloodstream spike sharply within 2 to 4 hours after eating. Then add sleep to this picture. Your body anticipates evening as a deceleration phase, not an all-out cardiovascular emergency. Instead, your heart's working overtime to process that substantial dinner while simultaneously trying to transition into recovery state. Those two demands directly contradict each other. For someone past 60 who's already experiencing vessel stiffness and cholesterol deposits, this conflict can be serious. Extensive research demonstrates that eating within 2 to 3 hours before sleep correlates with increased nighttime blood pressure, greater instances of reflux that can resemble cardiac symptoms or precipitate them, and higher cardiovascular event risk during sleep. The answer is straightforward. Complete your primary meal between 6 and 7 p.m. if feasible. When eating after that, keep portions modest, with emphasis on lean proteins and plant-based foods instead of calorie-dense, fatty options. Does your dinner pattern match what I just explained? You might be surprised how many acknowledge yes without realizing its cardiac implications. Now, I need you to focus closely on what comes next, because this is where some of the most preventable complications happen. In my experience, if you're over 60 and managing high blood pressure, and statistically over 60% of people your age take these medications, the moment you take it makes a tremendous difference, significantly more than most doctors clarify. For most individuals, blood pressure follows a regular daily cycle. Morning brings elevation, afternoon peaks, evening drops. But many people over 60, particularly those with hypertension, skip that normal nighttime reduction. Their pressure stays elevated or even spikes during early morning. Medical terminology calls this nocturnal hypertension. Few people recognize this condition, yet it carries dangers that daytime high blood pressure doesn't produce. Your arterial tissues aren't equipped for abrupt pressure surges while sleeping. A 3 a.m. blood pressure spike affects your vessels completely differently than a 3 p.m. spike. It's more capable of rupturing vulnerable plaque inside heart arteries, more apt to create a clot, more likely to result in my performing emergency surgery. When you consume blood pressure medication only in the morning, protection may have faded before your body needs it most. When you forget entirely, you're essentially undefended during nighttime hours when risk peaks. The approach? Have a specific discussion with your physician regarding medication timing. Specifically ask whether evening administration instead of morning could be better. That conversation takes just 2 minutes. It might extend your life. Compelling research, including the Haya chronotherapy investigation, shows evening blood pressure medication substantially lowers cardiovascular risk during sleep. That's not a trivial modification. That's a potential life-saving discussion. Assume nothing about timing's importance. In cardiac medicine, timing changes everything. Yet the majority of people over 60 have never initiated this conversation. Think about someone you know who snores, perhaps your husband or wife, perhaps a parent, maybe yourself, that loud, broken rumbling throughout the night. People typically dismiss it as bothersome, funny even, something earning a nudge from a frustrated partner. I consider it a heart disease red flag until evidence proves otherwise. Throughout my 20-year career, I'm speaking literally. Sleep apnea ranks among the most overlooked and underestimated illnesses in people over 60. Experts estimate over 30% of older people experience some degree of sleep apnea, yet the overwhelming majority go undiagnosed and untreated. They're completely ignorant of its nightly cardiac damage. What takes place during sleep apnea is this. Your breathing halts for 10, 40, sometimes 60 seconds or longer. It may occur repeatedly each hour, dozens of times. Every episode plummets your blood oxygen. Your brain identifies crisis and triggers a survival reaction instantly. Stress chemicals release, cortisol spikes, heart rate jumps abruptly, blood pressure shoots up. Your heart jolts awake while your body remains unconscious, repeatedly, night upon night, year after year. Picture this repeating 30, 40, possibly 50 times in a single night. The cardiovascular strain is anything but mild. Sleep apnea produces a threefold boost in heart attack likelihood. Consider how significant that statistic is. It links strongly to abnormal heart rhythms, particularly atrial fibrillation, which sharply raises stroke probability. It accelerates arterial stiffening and narrowing. Because it happens during sleep, you remain oblivious until serious cardiac damage strikes. Signs aren't always visible. Loud snoring qualifies as one, though multiple others exist. Watch for morning headaches, persistent exhaustion despite sleeping adequately, frequent nighttime bathroom trips, waking with a parched mouth, or waking gasping for air. If these symptoms match yours, ask your physician about sleep evaluation. Here's my direct guidance. Should you snore loudly, exceed 60 years old, and carry cardiovascular or stroke history, sleep apnea assessment isn't optional. It's mandatory for cardiac safety. The typical therapy, CPAP machines, aren't elegant. I acknowledge that. However, scientific proof regarding cardiovascular advantages is extraordinary. Consistent CPAP users show measurable blood pressure drops, decreased irregular heartbeats, and substantially improved cardiac outcomes. One apparatus, one behavior, tremendous benefit. Does anyone in your house snore? Has someone mentioned your breathing stopping? Reflect genuinely on this question. Let me discuss another behavior guided by sensible reasoning, which explains why it's deceptively simple to disregard. Numerous people over 60 deliberately limit evening consumption. The motivation is completely logical. They aim to skip 2 a.m. bathroom interruptions. Fragmented rest is irritating. Nighttime movement increases falling odds. Consequently, they minimize fluids post-dinner, occasionally not drinking after mid-afternoon. I comprehend the rationale completely. Yet, cardiologically, retiring even mildly dehydrated represents significant cardiovascular hazard, and it's barely discussed. Dehydration makes blood denser. Thicker blood doesn't circulate smoothly through vessels. For young hearts, that's normally manageable. For someone past 60 with already stiffened vessels and plaque formation, circumstances differ dramatically. Denser blood moves sluggishly through already narrowed passages. Blood clot formation becomes more probable. And here's the timing element most overlook. During sleep, heartbeat naturally decelerates. Circulation similarly slows. Add that reduced flow plus thicker blood in an immobilized body for 7 to 8 hours, traversing potentially obstructed passages. That mixture, insufficient hydration, reduced pulse, no movement, existing vessel narrowing, partly clarifies why early morning brings elevated cardiac and stroke occurrence. Fortunately, the remedy is remarkably uncomplicated. Consume 1 full glass of water before retiring. Nothing excessive, approximately 8 ounces suffices. It prevents unnecessary blood thickening overnight. Position another glass beside your bed. Should you awaken thirsty at 2 a.m., your physiology is requesting what your heart requires also. Balance excellent sleep with cardiac protection. You needn't sacrifice one. Here's one more behavior nearly every patient finds surprising when I bring it up because it appears too elementary to matter significantly. What's your sleeping quarters temperature at nighttime? Most individuals have never examined this through a cardiac lens. They focus on comfort. They consider personal inclination. But your heart actually thrives within a particular temperature band. Outside that range, your heart labors substantially harder, invisibly. Consider an overheated bedroom. When temperature climbs over approximately 22 degrees Celsius, roughly 72 Fahrenheit, your body must continuously shed excess warmth. Blood vessels expand, pulse remains high. Perspiration increases, which raises fluid loss, circling back to that dehydration hazard we addressed. More significantly, sleep quality suffers. You skip the profound restorative phases where your heart completes its most vital overnight recovery and maintenance. Now consider extreme cold. Below approximately 16 to 17 degrees produces different cardiovascular strain. Freezing triggers vasoconstriction. Vessels narrow to maintain inner warmth. As they tighten, pressure climbs. Your heart pumps harder against resistance. For someone managing coronary disease or high blood pressure, that nighttime pressure rise matters considerably. The perfect bedroom temperature for sleep excellence and cardiac wellness ranges between 18 to 22 degrees Celsius, or 65 to 72 Fahrenheit. Within that window, your body achieves thermal equilibrium, vessels remain loose, pulse stays calm and controlled. Sleep achieves deep restoration, one thermostat configuration, legitimate protection. What I've outlined might appear like an extended worry catalog, but examine it differently. These 5 behaviors collectively form a practical heart protection strategy for every evening. I term this the cardiac safe evening plan. It fits naturally into routine life without needing serious habit overhauls. Here's the framework. Between 6 and 7 p.m., have your primary meal. Select lean meats, vegetables, and modest carbs if desired. Not a celebration feast, not skipping altogether, just sensible nourishment at a fitting moment. This grants your heart 3 to 4 hours completing digestion before sleep begins. By 7 p.m., switch focus to hydration and prescriptions. When you haven't specifically discussed blood pressure medicine timing with your healthcare provider, use this as motivation to start that conversation. For many, evening dosing delivers significantly enhanced overnight protection. Take this seriously. Between 8 and 9, commence winding down. Stroll gently, enjoy literature, chat peacefully. Abandon screens now, particularly bright phone displays, which reduce melatonin and maintain nervous activation longer before rest. By 9 p.m., adjust your sleeping space, set your thermostat, crack a window if necessary, set a water glass on your nightstand. These actions consume under 90 seconds yet carry weight. By 10 p.m., be resting, and one extra detail costing nothing. When you snore or someone's mentioned breath stopping during sleep, rest sideways rather than supine. Back sleeping dramatically intensifies airway collapse. Positional adjustment alone meaningfully decreases sleep apnea incidence pending medical consultation. Dinner by 7, liquids and medicine by 7, calm activity until 9, bedroom prepared by 9, asleep by 10, resting on your side. The question isn't whether this works. Research confirms effectiveness. What matters is whether you'll genuinely practice it. That answer belongs to you. Let me address you genuinely for a moment, not as an educator, but as a surgeon. I've stood beside an operating table at 3 a.m. holding a heart that quit because a blood vessel had blocked overnight inside a constricted artery. I've conversed with families sitting in waiting rooms at sunrise, families completely unaware anything was amiss when they said goodnight hours before. I've examined post-mortem findings on individuals planning their grandchildren's birthday celebrations merely days earlier. Consistently, the causes weren't mysterious. They were skipped medications, late eating, an excessively warm bedroom, dehydration that accumulated silently, an airway collapsing quietly for years while individuals thought snoring was benign. These aren't anomalous or complicated dangers. They're simply everyday background of ordinary nights. Yet that background, recurring night after night, year after year, transforms into the unexpected cardiac event because nobody recognized where danger hides. My greatest realization from 20 years in surgical rooms is this. Almost every heart I've repaired failed not from misfortune. It failed because vital information was missing, information the individual never possessed. You now have that information. The question is your action starting tonight, not after your appointment, not next week, tonight. Let's consolidate everything. 5 behaviors, 5 remedies. Leave with concrete steps, not vague worry. First, complete dinner between 6 and 7 p.m. No extreme restriction, simply sensible eating at a sensible moment. Second, consult your physician regarding blood pressure medication scheduling. Ask specifically if evening dosing fits your situation. This single conversation may become your most important medical exchange this year. Third, if snoring occurs, you wake depleted, or someone's mentioned stopped breathing during sleep, undergo sleep apnea screening. After 60, it's not discretionary. It's fundamental cardiac safety. Fourth, drink 1 water glass before sleep. Keep another beside your mattress. Don't permit blood thickening simply to prevent bathroom trips. Fifth, maintain your bedroom between 18 to 22 degrees Celsius or 65 to 72 Fahrenheit. This single modification protects your circulation and doesn't cost a thing. I'd like asking you something personally, and I genuinely value your response below. Which of these 5 behaviors applies to you? I suspect 2 or 3 probably resonate. If they do, you're definitely not exceptional. Most of my patients find themselves somewhere in this list. The distinction is you now comprehend how to address it. Should this video prove beneficial, distribute it. Almost certainly someone nearby, a partner, sibling, friend, or family member past 60, hasn't correlated their evening behaviors with cardiac wellness. Transmit this their direction. Guard your heart. It's labored faithfully for you constantly throughout your complete existence. Supply it the circumstance needed for continued function ahead. One closing reflection. Everything shared represents standard medical facts grounded in contemporary cardiovascular science and my professional experience. It cannot substitute individualized medical assessment. Prior to shifting your medication routine, particularly blood pressure medicine timing, consult your personal physician. It's not merely regulatory language, it's genuine guidance from Dr. William Lee, someone truly hoping you'll continue watching this channel for the next decade. Good night. Rest well. Starting this evening, look after yourself.